Hi, today I'm gonna talk about cancer and nutrition intervention. First, I'm gonna start. What is cancer? Cancer is a disorder of cell growth, abnormal cell division that is not controlled. Cells invade other tissues and spread all over the body. As it's seen here that cancer is the second leading cause of mortality in the US. The overall mortality rates from cancer have declined. The most common types of cancer include breast cancer, lung cancer, prostate cancer, colorectal cancer, and melanoma of the skin. Genetic cancer. Mutation in genes may occur due to exposure to chemicals, physical agents, viral agents, bacterial agents. Two significant categories develop cancer: oncogene and tumor suppressor gene. The etiology of cancer is multifactorial. We have genetic and environmental. Environmental cancer: exposure to sunlight, radiations, chemicals, and carcinogenic substances. Also viruses and bacteria. Epigenetic cancer: study of changes in the gene, but does not cause any changes in the DNA sequence. Nutritional genomics: the study of genetic variation that causes different phenotypic responses to diet. Cancer prevention guidelines: we have maintenance, eat, and limit. Maintain the ideal body weight or the healthy body weight. Eat fruits and vegetables. Eat whole grains. Limit alcohol and processed meat. Signs and symptoms of cancer: we have unexplained weight loss, fever, fatigue, pain, and skin changes. Nutrition protective factors: we have fruits and vegetables, whole grains, fiber, and vitamin D. What is cancer cachexia? It is abnormal metabolism of carbohydrates, proteins, lipids, involuntary weight loss, muscle wasting, and decreased quality of life. Cancer and nutrition: heavy consumption of meat, intake of total fat, saturated fat, alcohol, specific food preparation such as smoking, salting, cooking at high temperature, overweight, and obesity. However, the actual evidence is still not profound regarding nutrition. But still, there is no direct link that this food causes that specific type of cancer. Nutrition therapy. Nutrition therapy is the nutrition science that benefits overall wellness and has therapeutic benefits to help manage cancer disease. Nutrition implications' primary goals is to prevent malnutrition and to create nutrition intervention. So, the ideal way to deal with a cancer patient is to do nutrition assessment, diagnosis, and intervention. I'm going to start with the nutrition assessment. Nutrition assessment is done by two tools. We have the PGSGA, Patient Generated Subjective Global Assessment, and MUST, Malnutrition Universal Screening Tool. Assessing patients' nutritional status is essential to see where they are. Many patients lose weight, they become malnourished, and lose muscle mass. As this disease, sometimes people take chemotherapy experience severe symptoms that they don't tolerate the side effects of nutrition, such as nausea, vomiting, and abnormal bowel movement. Others who receive radiations may experience dysphagia or much pain when swallowing food. So at that time, the intervention gonna be decided depending on their assessment. Nutrition diagnosis. Nutrition diagnosis varies with type of cancer, tumor burden, and treatment modality. Possible diagnosis includes inadequate oral intake, inadequate fluid intake, and altered GI function. Nutrition intervention gonna focus on the common side effects of cancer and treatment. The side effects of cancer are nausea and vomiting, early satiety, mucositis, diarrhea, and other symptoms that are gonna be discussed in details during the nutrition intervention. Nutrition intervention for common side effects of cancer and treatment. Nutrition intervention of nausea, vomiting, and early satiety. Chemotherapy experience severe symptoms that they do not tolerate the side effect of nutrition such as nausea, vomiting, and abnormal bowel movement. Radiation therapy may experience dysphagia, such as pain when swallowing because of the radiation. So the use of nutrition intervention for common side effects of cancer and treatment to address nutritional status is to increase the density of the patient's food to make every bite count. For example, making a nutrient-dense smoothie to increase oral nutrient intake. Another thing to consider is selecting high-calorie, high-protein nutritional beverage. Different companies help patients to receive the required nutrients through those beverages. We have Abbott and Nestle. They help a lot by releasing these products for patients to help them reach their goals for their nutrients need. Nutrition intervention of dysphagia. Some patients may experience altered taste. These changes are very common. Some patients taste metal and some flavor nothing. At that time, the nutrition intervention is to advise the patient to replace the metal utensils with plastic utensils. This can help them to have their nutritional food easily. Nutrition therapy of anorexia. First, anorexia is a loss of appetite. So to overcome this side effect, the patient is advised to eat smaller and more frequent meals, maximize the intake when appetite is most normal, limit fluid with meals to avoid feeling of fullness, keep favorite foods readily available at all times, mild exercise as tolerated. Nutrition interventions during chemotherapy and radiation therapy. Patients with chemotherapy and radiation therapy who cannot ingest adequate fluids and food orally and are malnourished need specialized nutrition support to the body with the needed nutrients. At that time, enteral and parenteral nutrition is considered. First, what is the enteral nutrition and the parenteral nutrition? The enteral nutrition is indicated for patients with a functioning GI who have inadequate oral intake for 7 to 14 days. Parenteral nutrition is for patients who cannot eat or absorb enough food through tube feeding formula or by mouth to maintain good nutrition status. Nutrition interventions before and after surgery. Patient surgery is a controlled trauma that would let the patient need a high protein and high calorie intake. So it is recommended that a good nutrition intervention before surgery to avoid malnutrition. After surgery, unless the gut is not working, it is recommended to use enteral nutrition to stimulate the intestine and reduce complications. Interventions for hematopoietic cells transplant. The immunosuppression may be considered from a bone marrow transplant. Here, Aspen recommended things to help patients with bone marrow transplant. Appropriate for patients who are malnourished and anticipated to be unable to ingest or absorb adequate nutrients for a prolonged period of time. Enteral nutrition should be used in patients with a functioning GI tract for whom oral intake is inadequate to meet nutrition requirements. Pharmacologic doses of parenteral glutamine may benefit patients. Monitoring and evaluation. Weight and weight changes should be measured. Calorie and protein intake must be determined to avoid malnutrition. As a conclusion for what mentioned before, nutrition is essential for people fighting cancer. Nutrition fuels the body to maintain muscle and lean mass to perform their daily activities. It's also necessary for healing and supporting immune function. During cancer treatment, as well-nourished patient can get the right amount of treatment at the right time to manage the side effects of cancer treatment. So the patients should follow the nutrition intervention and ask the registered dietitian to give them the dietary advice so as to deal with their side effects and let them receive the needed nutrients that would help them to survive with cancer disease. Thank you.